What we're going to do now are move into two demonstrations or discussions by music therapists, starting with Holly Mentzer, who works with Dr. Casalith at Sloan Kettering, who's going to focus on the inpatient music therapy cancer program or music therapy programs at Memorial Sloan Kettering. And she'll be followed by Tim Ringgold from California, who's going to focus a little bit more on the outpatient setting. So if I could welcome Holly to the stage.
Thank you for your warm welcome, and I just want to say how delighted I am to be here among such esteemed colleagues in this wonderful community. It's very exciting, and I'm very pleased to share with you the inpatient music therapy program at Memorial Sloan Kettering. My presentation will include several video components, an introduction of our feature by CBS News, which also included Dr. Tomino's work, as well as Sloan Kettering's. I will look at some of the goals that music therapy can address in oncology, and a brief overview of the techniques that we may use that Dr. Casalith had mentioned earlier. I'm going to present 4 case studies and the different goals that we had in each case, many times based upon pre-existing conditions that these patients arrived to the hospital with, a history of anxiety and depression, which then, when you add cancer diagnosis, how overwhelmed they may become. And I have some video footage of some of the sessions with these patients.
In this morning's Health Watch, music therapy. A new study finds that a familiar tune can bring aid and comfort to patients who are suffering.
And today, as CBS News correspondent Michelle Miller reports, more doctors are prescribing music to help ease pain and to promote healing.
A new study confirms music therapy is now helping patients suffer less anxiety and pain.
The history of music therapy in the United States goes back to the end of the Second World War, when many soldiers who had what was called shell shock at that time were undergoing a tremendous degree of stress.
Karen Popkin is one of 5,000 music therapists across the U.S. using instruments and song to make the lives of their patients better.
When you're in so much pain and there's nothing they can do, there's no medicine that fixes it, and the only thing that did help me was integrative medicine. I had Karen come in and sing for me, and I actually slept for an hour.
So as Dr. Casalith mentioned, music therapy is really used to help these patients cope with the difficulty of their hospitalization. And the study that the reporters mentioned was a recent 2011 Cochrane review that included almost 2,000 patients, 30 studies that showed the efficacy of music therapy as an intervention against both anxiety and pain. And the study looked at what we were discussing earlier, whether music therapy or music listening was more effective. And it showed that really any form of music listening is effective, but music therapy is best able to address the specific needs of the patient and its most flexible option. And it's best suited to address specific goals, which we may only have moments to assess what the patient's goal is. Sometimes we only have one session with this patient. So we do look at the chart beforehand, but we then have to figure out what their immediate need is. And music can be, as the study showed, is effective at reducing depression and anxiety, but it's also a perfect modality to increase communication between the patient and the family, and the family is under incredible stress, just as the patient is. And music then will provide an outlet to express feelings. It often brings up tears. It's very spontaneous, helps patients recall happy memories. And it's also shown to reduce the physical pain that cancer can cause and the emotional pain. The patient has certain choices during the session. We do not go in and say, we believe that you would best be served by this type of intervention, we offer the patient a choice, which gives them a sense of control, which is very important in oncology setting. And then hopefully we try to engage the patient actively if possible, because that frequently will increase their energy level, as does music listening. But to engage actively increases their oxygenation level. Sometimes they'll sing, and that will often increase motivation for the patient to receive treatment for other members of the care team, such as physical therapy, which is very important in their recuperation. And the first thing we would do is offer what type of intervention is available. And I play guitar and harp primarily. We also have electric keyboard, which is very portable. The guitar and harp I find is particularly soothing because it's an acoustic instrument. And I feel that the vibrations are comforting. And there are certain images that are associated also with the guitar of feelings of like a campsite feeling. It's a very intimate instrument. Harp is very beneficial for relaxation. We may offer music-assisted relaxation, encourage the patient to imagine the most beautiful place they've ever been to in their life, and that takes them to a very happy memory. Active interventions may include singing, discussing the meaning of lyrics in the songs they've chosen, and patients may often participate by playing instruments. We have a collection of percussion instruments that are very simple, that you can play with no experience at all. Some even learn an instrument while they're receiving treatment over the course of a few weeks. A lot of people come to the hospital and say, I've always wanted to play guitar. And we can, so it's not really music therapy, but it offers an outlet for self-expression if they can master an instrument or just begin to acquire some of those tools. And we also do songwriting in the hospital, which it can be very simple. It can just be substituting a word in a familiar song, or it can be composing your own rap song. So my first case, Ms. B, was a woman with advanced ovarian cancer. Her mother died of ovarian cancer when she was 53 years old. So this patient was envisioning her mother's illness and was overwhelmed. The staff noticed that she was very anxious, tearful, and was very concerned about her daughter's well-being in the case of her end of life. But she had actually very strong coping skills. She was typically a positive person. So music therapy they contacted integrative medicine to request music therapy. And I had only one session with this patient, but she quickly, I asked her what was important to her in music in her life, and she thought, I think of parties, and I think of drumming. So this patient who's in the intensive care unit, because she was admitted for fever and dehydration, but she was beginning to recuperate, and so she participated actively on a simple drum, and she had her sister-in-law was visiting, and it became a little party. Her sister-in-law is playing a little egg-shaped maraca. Three little birds, the three of us. She's smiling, interacting, and she was soon discharged after this session, so I didn't have the chance to work with her again. Sorry. My next case, Mr. L, had a long hospitalization with many complications. He was admitted for a bone marrow transplant, and he was being followed by psychiatry because he was presenting as a very gruff, with poor eye contact and an irritated affect. When I first encountered him, he had a dark beanie pulled over his head and seemed very withdrawn, but he quickly shared with me how much he loved music. He told me he used to play in a band, and he welcomed music therapy at all times during his hospitalization. He would turn away physical therapy frequently, so I would use music to try to keep him active and encourage him to play a drum whenever possible to at least keep his upper body moving. And in this video that I'm going to present, he was beginning to experience sepsis, and he was having waxing and waning delirium. And I would use music to reorient him to being in the hospital and to keep him focused. And you can see in the video that he's becoming playful. He's engaging with the therapists. I have a music therapy intern with me, and it provides a chance for him to socialize and to communicate. He was a big fan of the Doors, a rock group from the 60s. He knew all their songs. So we chose his favorite music to engage him. Woo, he says at the end. Very different from the man who I encountered when I walked in the room, huddled under the bed covers. My next case, Dr. S, was a professor of literature who I first encountered also in the intensive care unit. He had recent surgery for a chordoma, which is a tumor that can occur anywhere on the spine, and a history of prostate cancer, and also basal cell carcinoma, and also a history of depression. He was quite despondent over his third cancer diagnosis, and also probably the most overwhelming for him was his loss of sight as a result of the surgery. Even though the doctors assured him that he would recover it, he was quite anxious about this. He was experiencing delirium, so he was referred for music therapy to try to calm him, and I found that it had a very calming effect on his restlessness. Okay. Our clinical goals, this is the second session that I will show, was to help him access his emotions. In our first session together, he had a cathartic experience and he began to cry. He asked me for a piece of music called, which many of you may know, the Concerto de Aranjuez, the guitar concerto by Joaquim Rodrigo, very famous piece, and it's very melancholy. And I was wondering why he chose this piece of music. And I asked him, what attracted you to this music? And he began to engage in a dialogue with me. He quickly assumed his role as a professor. And I mentioned that I was applying for a postgraduate program, and he said, "I'd like to help you with your research." And it kept him awake all night. So during the second session with him that I caught on the video, he told me he was thinking about it all night, and he wanted to share with me his ideas about why people are drawn to certain types of music. You can see his arm is heaving because he's crying. He's covering his eyes. It seemed to affect you as intensely as yesterday. He was also a little hard of hearing.
I think I answered your question. What you were asking me yesterday. Mm-hmm. And then I was rattling on.
Like professors often do.
In a wash in academia.
I enjoyed hearing everything you had to say.
Well, thank you. But then I thought, is what you're trying to do to discover what makes some music appeal to people who are in need, who have this physical need.
Which I think is what he was using music to access, to relieve him from his madness.
And I think that's what you were doing.
Thank you, Professor. In my next case, Ms. M. Was a 50-year-old. She is a 50-year-old woman with. She had multiple surgeries, and also an extensive history of depression, anxiety, as well as suicidal ideation because of her despondency over her diagnosis. She was referred to music therapy by the nursing staff to address the depression and anxiety that they observed. Our goals with Ms. M were specifically to reduce anxiety and depression. And in the video, you'll see one of our music therapy interns using 3 different songs to address specific needs that were all associated with her anxiety and depression. One part was her spiritual life was very important to her. She actually she did sign language in her church to assist the deaf in the congregation to understand the service. So you'll see her signing in the hospital bed, and which provides an outlet for self-expression, because that was one of her typical ways of expressing herself as a healthy, before she was hospitalized. And this spiritual support helped to support her coping strategies. And you'll see in this first song, she's under the covers. She's singing a little bit, but not moving very much. She's beginning to sign.
Oh, how bright the path lives from day to day, leaning on the everlasting arms.
Now she's becoming more animated. Watch her hands doing the beautiful sign language. Now she's sitting up, singing in full voice. Anybody wants to sing along, feel free.
We used to sing sha la 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 sha la 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 la. That was awesome. Yeah, that was fun.
So now she's sitting up out of bed and much more animated after her music therapy session. My last case, Mr. G, was also inpatient for a transplant, and he had many complications during his hospitalization, including addressing his medication for his depression and anxiety, which he was very involved in. He was very aware of his mood, and he would actually kind of dictate where he wanted the music therapy session to go based on his mood and how his medication was helping him. He also was noted to have ineffective coping skills and was having fears of death and dying. In the session that I'm going to show on the video, the video is taken a few days after he experienced steroid-induced psychosis, and while he was in the intensive care unit. He was admitted for respiratory insufficiency, and while he was in the ICU, he was becoming aggressive to staff and showing a lot of anger. So the music therapy session I had, which I don't have on the video, it was represented a big change in our treatment, which had been previously kind of familiar popular music. He became very angry and said, "Stop! I need to hear." The computer just went out. I need to hear something soothing, classical music. And I said, "Oh, and well, I have a harp," and I brought in the instrument and I began to play Bach for him, and he began to weep. So in this session that I'm going to show in the video is taken after his mood is stabilized and he's returned to the regular hospital ward. And he's now, thank you. He's actually looking forward to returning home and remembering how music was important to him when he was the father of his young children and would sing this music from Man of La Mancha. I should also mention that he was receiving the steroids. Steroids are frequently prescribed to prevent rejection of transplant of organs, including for bone marrow transplants. So they couldn't really withdraw the steroids. They had to just taper it until his mood stabilized. So in this song, he's remembering singing this very important music to his daughters. And I'm playing the harp again because he found it so soothing after that episode in the intensive care unit.
I have sought thee, sung thee, dreamed thee, Dulcinea. Now I found thee, and the world shall know thy glory. Dulcinea, Dulcinea. That's not a love song, I don't know what it is.
A big change from what I'd seen a week before. My next, I just have a few short videos of some other patients that engaged actively in music therapy. This young lady is a 25-year-old woman who had just had surgery for a sarcoma in her leg and was having a great deal of pain. When I met her, she said, no, I don't want music therapy. Massage is the only thing that will help me. I said, well, unfortunately, I'm not a licensed massage therapist, so I went to offer to her neighbor, as she suggested, and then she heard that I played the harp, and she said, oh, you play the harp, you can come back. And she had always wanted to, she loved the harp, she had a fascination with it, and so I actually let her try to play the harp a little bit later. But first, because she was having shortness of breath, and she's, you'll see her using what's called an incentive spirometer, which is used to increase resistance in the lungs. And singing is also very helpful for building up your lung capacity after you're having this issue with shortness of breath. She's ready. She told me after our first session that she completely forgot about her pain. And I just thought that was a real testimony. She was so involved with the music that she forgot about the tremendous pain that she was experiencing. And then in the next session, because she was about to be discharged very soon, and she said that she always wanted to play the harp, so I offered her mine. Look how excited she is.
Can you feel the vibrations?
She had what I often encounter people. I think that there's a condition called harp goggles. When they see harp and it's something magical. I can't explain it. And this is a 9-year-old boy who had acute lymphocytic leukemia and was inpatient for chemo for a few weeks. And he learned how to play the ukulele while he was in the inpatient ward. This is one of our music therapy interns. Worked with him for a couple of weeks, and he'd mastered the song.
Here comes the sun, here comes the sun, and I say it's all right.
Yeah. Imagine how wonderful it is for the parents to see this during the hospital stay, to see that their child can still learn even while they're coping with this very difficult thing. It's very normalizing. In conclusion, in addition to all the symptoms that the previous presenters addressed specifically, which are more related to that your motor movement and memory, so many things that music is so helpful for. In the oncology setting, we're mostly addressing emotional issues, including anxiety, pain, and depression. And music therapy is ideally suited to address a variety of needs because it is so flexible. And I believe that through music therapy, we're continuing a tradition that is actually, it's connected to what music was originally created for. As Dr. Castle has said, it was often communal. It's something that I think is very primitive and innate in our needs, and just as important to us as blood and water in our bodies. So I would like to conclude just to play a little music for you, since we're in this beautiful city. You've probably heard the Native American flute everywhere you go in the hotel. It's when I was last in Santa Fe, of course I wanted to buy one because I'd heard so much about the health benefits of the Native American flute, both for the player and for the listener. From a player, you're increasing your lung capacity, it increases oxygenation, gives you more energy, and can bring you to a certain place of spiritual awareness, which is so important here in this area. And to the listener, it imparts a sense of calm and peace. And when I've played it for patients, I've had many say it brought back memories of happy memories to their trips to the Southwest, and it really specifically Santa Fe. Thank you very much. Thank you. If there are any questions, I think we have maybe just a couple of minutes.
Thank you, Holly. That was beautiful.
Thank you.
So I'll start off with a question, and it occurred to me there's been a lot of questions, I think, from both scientists and music therapists in the audience about whether listening to an iPod or sort of passive listening to music, which we think is beneficial, I suppose, through an iPod or an audio system because it creates a different environment. You talked about environmental music. But I can't believe that that's somehow not vastly different from interactive music with a real music therapist or a patient. And if you think about future science or clinical trials we might do, I wonder, Barry, if that could somehow be measured. And I think back to, again, to Annie Patel and some of the presentations we've heard, looking at the interactions that music creates in children to make them more cooperative and more interactive. And many of the videos that you showed us clearly are reducing pain and anxiety, but bringing joy to those patients in a way they're more interactive with you. And I can't believe there isn't some common basis to that. In humans, you talk about the communal nature of music and the communal need for socialization through music. I just think it would really be interesting to test that in a clinical setting. Somehow I intuitively want to believe that, but I don't know if it's true. Do you want to comment on that, Holly? Have you guys actually looked at sort of just playing music for a patient from actually doing a real interaction with another human being that's more active?
Well, that's a very interesting question. I mean, it actually is one of the components of what makes music therapy different from music, and there is, I think, a very important component of what we do is the therapeutic relationship and just this connection from one human to another. And there is actually, in research, a lot of question has to be, you have to ask how much of the effect, the positive effect of some of the research out there is because of the positive benefits of the therapeutic relationship, and how do you separate that? It's extremely difficult because often the therapist is the researcher. So that's an important question that perhaps should be addressed by future research, but it's really, I think the clinical relationship is something that you can't really separate from the therapeutic process.
I think that's a wonderful question, and I am not a technocrat. I have an iPad, and I had it for several weeks, and I figured out that I wasn't going to learn how to use it. So I gave it to Karen Popkin, who is our head music therapist, and she actually used it in the hospital. And she found an app. I don't even know
it's the GarageBand app probody that you're speaking of.
That's right.
Yeah, one of our interns actually did songwriting with it.
Yes,
yeah.
And not only that, but she used it, or one of you guys used it, on a little boy who was not interested in musical instruments, but he was very interested in the iPad. Yeah. And there was some kind of an app that enabled him to play, I think it was the guitar, on the iPad. And he was in seventh heaven. And it was very helpful to him. I don't imagine that most adult patients would prefer that, but we have since received several iPads because we may have other children who need it. But I think it's a great research question.
That answered one of my questions, but another question that I had was that obviously in your center, music therapy is an integrative part of what you do, but I'm wondering to what extent in Middle American hospitals or hospitals outside of major metropolitan areas, to what extent is music therapy supported, to what extent is it covered by medical insurance, and to what extent is it accessible for patients that are not fortunate enough to have access to it?
I think one of the things we should say, Holly, right away is the Gabrielle's Angel Foundation, who supported this symposium, partly supports Barry's program. And Connie Tomeno made an important point this morning. Many of these interventions are not insurance reimbursable. So we pay out of the goodness of our heart and our philanthropic donors often to support these kinds of programs. That's about the only means to do that. Barry and Holly may want to comment.
Actually, there are many more music therapy programs around the country than one would imagine. And music therapy comes in all forms. It may come in the form of something that we have, and I know exists all over the country, which is a local church choir comes in once a week, or some students at a music therapy program come in occasionally. We are lucky to have some wonderful conservatories in Manhattan, and so we have students from some of the very best music schools who come and play for us, perhaps on holidays. It's not the same as music therapy, but it's music, it's an environmental music. But this kind of one-on-one therapy does require funding to support the people who are providing this very important therapy. And as far as I know, there is no insurance coverage for it whatsoever. And I think that it is an obligation of the institution to help support it, which is the case in many instances, and also of donor funds. And we get some donor funds from the Gabrielle's Angel Foundation, who also supported this wonderful conference, but not most. And I think you have to look around. There are a lot of people in every community who love music and who would be willing to support the cost of maybe a music therapist to come in 2 days a week, or a music internship program, or something along those lines to get things started. Everyone loves music, and people are usually willing to pay for it. You just have to go and ask, and I think you'll be surprised how successful you can be.
Holly, do you want to add anything to that?
Just also that I from looking at what jobs are advertised around the country, there is often more funding available for pediatric music therapy, because it's so important to keep the children's developmental stages moving, especially if they're inpatient for a long time. So you'll see that's more widespread. Not as much funding is made available or sought for adult settings, as even though I think it's just as critical. And it's also music therapy is also available through many hospice agencies as well.
Is music therapy allowed to be considered occupational therapy for children and then reimbursable? I think in some settings you can sort of hide your music therapy activity through an occupational intervention and charge for it. We do that at our children's hospital, I know. So I mean, there are all kinds of tricks that we play. Yeah.
I wouldn't know about that. We because we're funded by grants, it's not an issue, fortunately. In the state of New York, there is a licensure, and that does provide a possibility for reimbursement for people that are in private practice, and in some cases through agencies. But fortunately, we are supported by grants.
So Holly, thank you for that beautiful presentation. I love classical music, but you know, Van Morrison hits the soul pretty well too. That was terrific. A lot of our patients like Van Morrison. I don't know what that's about. It's a favorite iPod request. So thank you so much.